Okay, this training is entitled Post-Exposure Packet Review. So you have a packet that has been given to you by us. This packet is available to you on our web portal as well as through our company. So you can contact us and receive this packet in case you can't find it on our portal. And the packet should be in front of you as I go through this. And this training is really for your safety coordinator or office manager that is going to handle any incidents in the facility. So if, God forbid, you have an incident such as a needle stick or any type of a blood exposure, maybe you got sprayed in your face, nose, mouth, or eyes, or any type of a cut with a dirty instrument, things like that, or even a chemical exposure, you need to have this packet ready for any of those incidents. And this should be done prior to those incidents ever happening. So as a manager or safety coordinator, make sure you go through this packet with me and get it all ready to go in case something happens. So as you look at this packet, it basically begins with post-exposure procedure protocol, which is a 10-step protocol, which we're going to go over together. Then you're going to have a sheet called the Injury and Illness Treatment Information Sheet, which you have to fill in all the blanks prior to any incidents. Then, of course, you have an exposure incident form. You have accident witness report. If it's a Sharps injury, then you have to also know about how to complete a Sharps injury log. Then you have a post-exposure evaluation and follow-up form. And, of course, you need to also have a sample bloodborne pathogen standard section that needs to accompany the employee as they go to the emergency room. So everything is in this packet. And we can also talk about OSHA Log 300, which is something that you may or may not be required to put together. So certainly you can call us if you have an incident or any type of an accident in the facility. And if it is required for you to post this as a OSHA Log 300, we will advise you of that. But we're not going to cover that for the purpose of this training right now. So as you look at this, the first thing you'll notice in this packet is the post-exposure procedure protocol. The most important steps are the first 3 steps for employees. So you need to make sure you go over this with every employee. And of course, this is something that is covered throughout our training as well. But let's just go through this. Number 1, it says disinfect the area immediately. So disinfect immediately. For Sharps injuries, you want to squeeze the puncture area and wash with antibacterial soap or hand sanitizer, or pour a diluted bleach solution directly over the exposed area. Now, the ratio is recommended 30% bleach, 70% water, and according to infectious disease specialists and experts, diluted bleach solution is one of the best disinfectants for any type of bloodborne pathogen exposure. If you had a splash incident with blood or other potentially infectious material in the face, that's nose, eyes, or mouth, wash the area, the eyes, nose, or mouth with cold water using an eye wash station, preferably, or the nearest sink for at least 5 minutes. Then you want to do item number 2, which is report the incident immediately to your supervisor or safety coordinator. And then, of course, safety coordinator or supervisor will obtain consent for treatment, whether you want to go get treated or not. It is completely your choice as an employee to whether accept the offer to get treated or not. So once you say, yes, I want to go get treated for this, then they will hand you some documents. Now, let's go over these documents together before we complete this checklist. So go ahead and put the post-exposure procedure protocol aside, and let's take a look at the first document that is entitled Injury and Illness Treatment Information. Here, you have to decide which urgent care facility you're going to send your employees to. So this is usually the nearest hospital emergency room to your facility. You need to write their address here, as well as their phone number, and even driving directions. So this is the form that I mentioned earlier that you need to make sure that it's filled out prior to any incidents in your facility. The second section is the workers' comp insurance section information, and that's the name of your workers' comp insurance agency, as well as address, phone number, policy number, expiration date, and the agent or administrator, their name and phone number as well. Then item number 3 is a designated physician. Now, this could be their own private physician that they like to contact, but you have to have a physician's number. And one of the best ways to fill this out is to contact your workers' comp insurance company, and they usually provide you with a hotline, a medical hotline for employees to consult with a nurse or a doctor in order to get the right advice regarding their injuries or accidents or illnesses. And that's certainly something that you should have on here. And last but not least is, where are you going to send an employee that accepts your offer of vaccination for hepatitis B? Now, you could either send them to a medical facility to have these vaccines done, or even doing a blood test, which we call the titer test, or you can have the nurse come to your office and administer the vaccine in your facility. So that's your choice. Either way, you need to write down who the company is that is going to take care of this for the employee, their address and phone number, so they can contact them if they have any questions. Now, the next form that we need to go over is called the exposure incident form. Now, this particular form does not go with the employee to the urgent care facility. However, the other one, which was the injury and illness treatment information form that we just went over, that goes with the employee to the emergency room. Then this one is filled out right after or as you are doing everything else. This can also be filled out. This is basically a description of the incident. So date, name of the employee, title, department, so on and so forth. If there was a patient involved, meaning that the particular instrument was used on a patient, then you need some patient information. And then, of course, the actual circumstances of the exposure incident needs to be written there. Route of exposure, whether it was a needle stick, a splash, puncture wound, broken skin, etc., goes there. Then source individual, which is the patient's antibody status. Okay, so if the patient has consented to a blood test, which sometimes they do, sometimes they don't, it's good to know what antibody level their blood is. And of course, the date of the incident, the signature of the safety coordinator who's filling out the form, again, the date and title. And at the bottom here, it says, initial and date the following information, informing the employee of the following items, obtain a written consent within 15 days of completion of the evaluation from the healthcare professional. So wherever that you send the employee, they have 15 days to respond back to you with their conclusion of how everything worked out. And of course, the results of the evaluation and any medical condition resulting from the incident that requires further evaluation and or treatment. And then you want to maintain this record for the duration of the employment plus 5 years after the employee leaves. So this is an important document. And of course, another form that, again, you keep for your records, you do not need to give this to the employee to take with, is called accident witness report. And again, this is basically if there was a witness to the accident, they fill this out. So the name of the witness position in the company, date, the interviewer, which would be the safety coordinator who's doing this, name of the injured employee, date and time of the alleged work-related injury or illness, and certainly date and time of the reported incident to supervisor. And of course, the name of the facility, the safety coordinator's name, then the statement of the witness goes there. And then, of course, the witness also signs to verify that they have given accurate information to the best of their knowledge and the date. And this, again, is sustained for your records. Now, if you're a dental or medical facility, you're going to have your own Sharps injury log. So it says Sharps injury log for medical facility, and there's also one that is Sharps injury log for a dental facility. So depending on what type of facility you are, you need to make sure you have the appropriate form as a Sharps injury log. This is a requirement by Cal OSHA standard to be filled out. And it's pretty self-explanatory. You need to write the facility name, the treating doctor's name, and certainly the address, phone numbers, date that was filled out, and of course the date of injury and time of injury, and then description of the exposure incident goes there, job classification of the employee goes there, location or department of the incident goes there, then whatever procedure they were doing at the time of the incident goes there. And of course, the question is, did the exposure incident occur during this or between this or after this and all that kind of stuff. So you need to check the appropriate box there. Which body part was injured goes there. And of course, identifying the sharp involved, if you know what it was. Then, did the device being used have an engineered Sharps injury protection? Was it a safety needle or a safety feature on a blade or something like that? And of course, was the protective mechanism activated? That's very important. And did the exposure incident occur before or during or after activation? And of course, the last two items on the bottom, and it says, if the sharp item had no engineered sharps injury protection, do you have an opinion that such a mechanism could have prevented the injury? Yes or no? And then a quick explanation there. And of course, the exposed employee again says, do you have an opinion that any other engineering, administrative, or work practice controls could have prevented the injury? So they want your opinion as to how this could have been prevented. So that's it on the sharps injury log. And of course, the dental sharps injury log is exactly the same, except it's going to ask you dental questions instead of medical questions. Then the last piece is called the accident investigation. And the accident investigation basically goes through and asks certain questions about the accident. Again, very self-explanatory. Facility name, address, and so on and so forth. Investigating team, investigating accident, accident date and time, nature of the accident, nature of the injury, referred to medical facility doctor, yes or no, employee returning to work, yes or no, injured employee interview statement attached, who was the witness, witness statement attached, photographs of the site attached, diagram of the site attached, and of course equipment records, any type of equipment records that may want to be reviewed attached, and of course the incident description, accident incident description. Now, this also, again, is for the office's records, right? Now, the next form is called post-exposure evaluation and follow-up. This is another form that goes with the employee to the urgent care facility or hospital emergency room. And as you can see, this has the employee's social security numbers on it. So this is a private, or what we call protected health information. This will not stay in the records manual. This will be filed after you receive it back from the urgent care within the 15 days time that they have. This needs to be returned to you, and it goes and becomes part of the employee's permanent private file. And so this is very important. The urgent care facility has to fill this out in its entirety. And of course, if the employee does not want to go and get treated, then they have to sign where it says employee has given consent for blood test. And you check the box no, and then they sign that. And same with the patient, or we call a source individual. And if the patient doesn't want to go, again, you check the box no, and then they sign that. By the way, if you have any questions about any of these forms or how they're supposed to be filled out, please contact us at any time, and we'd be happy to take you through and walk you through this entire process. Now, the last item that goes with the employee to the urgent care is the copy of the bloodborne pathogen standard that is attached in your packet. That's the last piece of paperwork at the end of your packet, and it's about 5-6 pages, and you just basically give this to the injured employee and you ask them to take this to the emergency room when they arrive and hand it to either the nurse or treating physician at the time. So with that in mind, this concludes the review of your post-exposure packet. And again, if you have any questions, please feel free to call us at the numbers that you see on the screen. Have a great day. Thank you for listening.